Welcome back. It's time now for the France 24 debate. Now, it's been a dramatic 48 hours. The Italian government on Sunday announced that more than 15 million people in the industrial heartland of the country are being quarantined for a period of 4 weeks. Well, this came as the death toll from the coronavirus in Italy shot up to the highest level outside of mainland China. Well, the Italian Prime Minister Giuseppe Conte argues that these drastic measures are a bitter pill for the country's economy in the short term, but this will spare the country longer-term economic damage. Well, it's the latest shock to the global economy and markets plunged around the world. All of this as major crude-producing nations, notably Russia and Saudi, squabbled over oil prices. Well, in US trading today, crude saw its biggest daily drop since the Gulf War in 1991. And the IMF is warning of a sharp slowdown in global growth. Well, in today's debate, we'll be asking, how is it that a health scare has sparked a market crash? Is it a matter of time before other countries are forced to follow the Italian example? And just how much worse will things get before they get better? Well, first of all, let's take a look now at a summary of the impact of these events. Here's France 24's Wasim Kone.
Dozens of worried phone calls at this Parisian trading room. The French capital stock exchange plummeted more than 8% on Monday, the latest drop in a 2-week decline.
Okay.
Around the world, stock markets have also been in free fall. Trading rules at the New York Stock Exchange triggered a 15-minute trading suspension after the Dow Jones and S&P 500 opened down more than 7%. The reason behind this market crash, a dangerous combination for the global economy. On the one hand, an oil price war between Russia and Saudi Arabia, which sent the price of crude tumbling more than 20%, the largest drop since the 1991 Gulf War. On the other hand, the coronavirus epidemic, which has investors spooked.
The longer the stock exchange downturn lasts, the more negative effects there will be on the overall economy. So the risk is that some countries start entering a recession because of the coronavirus threat, which is weighing down on economic growth.
France's economy minister met with business representatives on Monday morning as the French central bank downgraded its predicted growth for the first quarter from 0.3 to 0.1%. Tourism and transportation have been especially hard hit.
We're talking about a 60% drop in revenue for caterers, a 30 to 40% drop for hotels, 25% on average for restaurants, and even bigger numbers for those working in events management.
Unlike Germany and Italy, though, France's central bank has not yet mentioned the risk of a recession for the country.
Well, here for the France 24 debate, I'm joined by Philippe Wechter, who is a chief economist at Ostrom Asset Management. Thank you very much indeed for joining us, Philippe. To my left is Jean-Pierre Favenec, who is a professor at IFP Énergie Nouvelle and a consultant at WD Corporation. That's a consultancy specialized in energy. Thank you very much indeed for coming to see us. From Durham in North Carolina, we're joined by Jonathan D. Quick, who is a professor at Duke Global Health Institute and an author of the very topical book, it would appear, The End of Epidemics, the Looming Threat to Humanity and How to Stop It. You're also a former director at the World Health Organization. Welcome to you. And last but not least, we're joined from Rome by Stefano Vella, who is a global health professor at the Catholic University of Rome and also a former director of the National Center for Global Health. Welcome to all of you. Let me start there in Rome, and I'd like to ask you, Stefano, what has been the sort of overall feeling about events these last 48 hours? Do people in Rome think it's a matter of time before those fairly draconian rules are applied to the south of the country? And do people feel like the government obviously has done the right thing?
Yeah, honestly, I would say that at the beginning we tried to tranquilize people that things will go better. But actually, from my experience from previous epidemics, let me say that this is a flu-like epidemic. It's like influenza. At least it's not like influenza in clinically, because fortunately for influenza we have a vaccine that protects the people, the fragile people. Here we don't have a vaccine, but the transmission of this virus is very similar. So what we are thinking now is that the course will be the same. maybe because of the measures that we put forward, we will stop it from having such a big number of new infections per day. Because our problem today, apart from the economics, is that our hospitals in the north are in a kind of burning out. We have no places enough, despite the fact that the system is a great system, like yours, like the French one. The number of patients in emergency rooms is huge. And many of the doctors, many of my friends are also getting sick. So let me put it like this. I'm scared that this will be like a flu-like wave. So it's impossible that the virus spread through respiratory means will stop. So in a sense, it's true that we have more cases in Europe and in the world, apart from China, but it's because by chance the epidemic started somehow in the north of Italy, but it will spread all over the world, and I'm pretty sure that it will be like influenza. We had 4 million cases last year in Italy. I don't know how many you had in Italy, in France. I hope we will not reach that number because of the measures. But definitely we need to be prepared.
Okay, let me turn our attention to Durham, North Carolina, and bring Jonathan D. Quick into this conversation, because, of course, you wrote that book back in 2018 about epidemics, and the case studies you had at the time were Ebola, SARS, smallpox, AIDS. Now we have a new situation on our hands. And I'm assuming when you wrote that book, you thought it was a matter of time before we had something like this. And in the book, you talk about the protocol and the right next steps that governments should take in a situation like the situation we're in right now. How do you rate the performance of world governments in correctly addressing the issues and the threats posed by the coronavirus?
Well, thank you. Indeed, that's one of the key questions. Could I just request? I'm getting a lot of loud background studio noise, which is actually making it difficult to hear the question.
Okay, sorry about that. Let me put that question to you again.
That?
Sure, I will ask the technical team to look into that.
But can we turn off? Okay.
Sure. We'll come back to you in just a moment. We'll come back to you in a moment when we've sorted out that audio.
Okay.
We'll come back to you.
Okay.
Let me turn to you here in the studio where we've got less of an audio issue. Philippe Vester, you're a chief economist. I mean, we've been talking about governments, healthcare apparatus underestimating the threat posed by the coronavirus. But it would appear that investors, to a certain extent, underestimate that threat as well.
For sure. At the very beginning, when we saw the epidemic in China, we all thought that it could be like the SARS in 2002. The impact on economic activity was a V-shape. So it was not an issue for everyone outside China. At this moment, it was just a healthcare problem in China, not an economic problem. Now it's and since we see that there is a contagion in Italy during the last 3 weeks, we change our mind, saying, well, we can have contagion outside China, and in that case, the situation will be very different from what we thought we had with the SARS. And that's the point. And more than that, we have had economic indicators from China which shows that it was a huge drop in economic activity in China, more than in 2008 after the Lehman crisis. So the situation has deeply changed in investors' mind and also in government mind, because it was something new, something we were not prepared for, and that's what has changed. And we saw that on financial markets, everything is down. The U.S. interest rates are at a level we've never seen. The 30 years interest rates on government bonds in the U.S. is less than 1%. The 10 years, it has 0.5%. So it's levels that we have never seen in the U.S. So it shows that people are really worried of this environment, and the scenario they had in mind has deeply changed. It's not a V-shape scenario, but something we don't know. We cannot draw very easily, and that's why we have seen all these adjustments on financial markets.
Indeed. And let me just turn to you, Jean-Pierre. Do you agree, first of all? And secondly, just looking at all those downward pointing arrows on the stock market boards today, that's not just about the coronavirus, is it? There's another dimension to this, which of course is oil.
We can first, look at oil. In fact, the drop in the oil price is fantastic. This morning, I saw something about 5% or 10%, but I realized this afternoon that the drop was from $52 per barrel to $35, which is extremely low. In fact, we knew this a few years ago. Looking at oil, in fact, the situation is not so new. I mean that. The situation I can recall quickly is that we had a situation 5-10 years ago when we had very high oil prices. After that, we had the apparition of shale oil in the U.S., a huge quantity of shale oil, and so the market was flooded with oil, and the price fell. The price fell to a very low level like today. After a while, you had agreements between OPEC countries and Russia to reduce the production and to make the price to increase. And we have seen what happened over the last days. In fact, it's also a political problem. Not only it's, of course, basically an economic problem, it's also a political problem. The situation is that due to the crisis, to the coronavirus crisis, we have less demand for oil. The demand would be reduced by 1%, 2%, 3%. Nobody knows exactly, but at least for a few weeks or a few months, the demand will be reduced by a few percent or perhaps more than a few percent. And we know that if you have a demand which is reduced by a few percent, the impact on the price is always very big. Anyway, the situation was that last week you had an agreement, you had a meeting between OPEC countries and the so-called 10+1, which are the oil-producing countries, not members of OPEC, and the first one is Russia. Saudi Arabia and Russia are the big oil-producing countries with the US now, are the very big producing countries. And for different reasons, they did not agree. We could expect at this meeting that they would agree to reduce the production, at least to avoid too big a fall in the price. And in fact, exactly the reverse came. And the reverse came for political reasons. In fact, Saudi Arabia was ready to reduce its production, but Russia did not want to reduce the production, especially because they were satisfied with very low prices, because they were in competition with the US, they are in fighting with the US, especially, for instance, for problem of sanctions, for problem also that they expect due to the very low price that the very big production of shale oil will be stopped or will be reduced. And this is a position of Russia which is extremely strong. I mean, very rigid, I would say in French, very rigid. And in order to fight this, the last decision of Saudi Arabia is to increase the production when we have already too much oil on the market. So we have a very low price, which is not bad for the economy. I mean, when I will go to the pump tomorrow morning, I will pay, for instance, my gasoline for 5 or 10 cents less than before. But basically, for the activity, it's bad. I mean that in the oil industry and in many activities, this fall in the price will lead to a reduced activity.
Okay, so what you're saying is that these events are linked, and it was the coronavirus that brought about that fall in demand for oil, which has then turned into a price war, which has again had a further impact on the market. So all of these events are linked. Let me just go back to Rome quickly before we have our break. And I just want to ask you there in Rome, Stefano Vella, what is the feeling there that the government has done this to protect the economy in the short term? That's the argument put forward by the Italian government. Is that an argument the Italian people think washes? Does it resonate with the Italian people, do you think?
No, I think that now the Italian people understood that the government did this to protect the health because the economy is actually falling. It's true. Because, the Lombardy and Veneto are our trains, our drivers of the economy, and for being in a zone. So I really think there is not an economic interest. I think the economic interest is if we are able to stop the epidemic, to lower the peak, or at least dilute the number of infections, then even the economy will benefit of this. So it was not an economic decision. I really think it was a public health decision to close, because actually we saw that in China, these measures that actually are not comparable, because some of the measures that China did have been possible only in China, let me say. So we are trying to copy their measures, the quarantine, because it worked. If you look at the data today,
it's contained it. It's contained it. It seems to have worked. We're going to come back to you, Stefano Vella, right after this short break. We've come to the end of part one of the France 24 debate. Stay with us. We'll be right back with you in just a couple of minutes. Welcome back to the France 24 debate, where we are discussing the global fallout from the coronavirus, which has caused the shutdown of Italy's industrial heartland. 16 million people affected in the north of Italy. I'm joined in the studio by Philippe Vester, who is an economist, chief economist, I should say, at Ostrom Asset Management, Jean-Pierre Favinec, who is a professor at IFP Énergie Nouvelle and a consultant at WD Cooperation. From Durham, North Carolina, we're joined by Jonathan D. Quick, who is a professor at the Duke Global Health Institute, who's written a book on this very subject of epidemics. And we're also joined from Rome by Stefano Vella, the global health professor at the Catholic University of Rome. We had some difficulty getting hold of Jonathan Quick before the break. Let's go to you now, Jonathan, in North Carolina, because I was asking you, since you've written a book about the protocol and the best steps that the authorities can take after an epidemic breaks out like this, how would you rate the decision-making process and the whole handling of this crisis by world governments, perhaps starting there in the United States?
Well, setting the stage here, this is the biggest potential pandemic threat that the world's had since 1918. And we now have the virus in nearly 100 countries. The vast majority of responses have been very strong, but not as strong as they could be. So the biggest challenge has been in a few countries, some stumbling right at the beginning. We saw that in China in the slow report, which is so critical. Here in the U.S., the overall response has been superb. There have been a couple of real challenges, though. Early on, the challenge with testing that has delayed the response, and it's so important. Getting the testing done is critical to knowing where the epidemic is, how big it is, and how fast it's progressing. Overall, though, the information, the mobilization from the national level to the state level to the local level of the public health community has been exactly what we would want to see.
Yeah, and in your book, you talk about all the steps that should be taken. I'm not going to list all of them. There are 7 key steps, but spending prudently to prevent, to nip it in the bud, so to speak, transparency, and preventing panic. Now, on the issue of transparency, a lot of people would have issue perhaps with China for not being upfront at the beginning. Now, how important a factor do you think that was in the spread of the virus globally?
That is absolutely critical. The first few weeks and months, time makes such a difference. And when an outbreak is caught early, we get 200 outbreaks a year in the world that are of significance. Those the vast majority get stopped really quickly because they're identified quickly and reported quickly. And the problem that happened now with this is very similar to what happened in 2003 with the first coronavirus that went global, the SARS virus. And that is, first at the local level, that there wasn't recognition and rapid reporting up the line, from what we understand, and then they're recognizing it and alerting others. That time factor is just critical.
Absolutely, and let me put this to the people in the studio with me here, all of us in Paris, obviously. I mean, the French government, since we're in Paris, has been transparent and has admitted that there is an issue. There's been no glossing over of the facts here in France, has there? How would you say the French government has handled this?
Well, it has done a lot. The question on government action is a trade-off between what will happen if it's an epidemic and what will happen if I act too early. You know, that's the point. If you act too early and there is no epidemic because it has not been verified by scientific, it costs you a lot. If you don't act immediately, it will cost you a lot also because it's an epidemic. You know, that's the very complicated arbitrage. So when we see it 2 or 3 months after the beginning, as we can see it from China, it's easy to say we should have done before. And it's the same in Italy, it's the same in France. But at the moment, you have to manage a trade-off between the two. And you're never sure, before you know it exactly, you're never sure that it's a real epidemic. And so if you take too much measure to fight it, it can have a very high cost in terms of economic activity. So you delay, you try to do it you try to do it when it's impossible to do differently. And that's the problem with this type of situation.
Your thoughts?
Yes, but my view is that now we are in France and in many countries in a situation where people do not want any risk. And so the government is very keen about trying to avoid any risk, any possibilities that it can be accused later. Remember what happened when we had the heat wave in 2003, what happened for some similar situations. The government was heavily contested, so the government wants to avoid anything. And we are in a strange situation where, in fact, apparently from what I understand, and we can ask people in the studio to have an answer, the risk is relatively limited. I mean that, of course, you have a few people who get very, 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 very ill, and some of them die. But typically, the rate of death is in the range of 1%, 2%, 3%, something which is limited. No more save many people than the traditional flu. So, but I'm a bit stupefied by the fact that you have such deployment of means for this coronavirus and epidemic, and for the flu, the traditional flu, which is probably more, which has caused more deaths this year. So I don't. This is just a remark.
Yeah, and we were talking earlier about how China has handled this issue, and on the one hand, we were saying they hadn't been completely transparent, but on the other hand, they've got tools at their disposal that we don't have in Western democracies, namely shutting down entire cities, really with an iron lock on the whole area, and we can't basically hope to replicate the Chinese model for handling the threat posed by the coronavirus here in Europe, can we?
I think what they are doing in Italy is close to what they have done in China around the so-called Wuhan town and all the region around. So we are coming to this kind of, and when we see in France that we have closed schools and universities in 2 departments in the east of France and close to Paris, I wonder whether, perhaps I'm a bit bad prognosticator, but I wonder whether in a few days or a few weeks in France we'll not have to take the same decisions. I don't know.
Do you agree that it's a matter of time before France has to go down the same road as Italy?
Probably. You know, the point is that you have to act very quickly. When you are the epidemic is confirmed, you have to act very quickly to avoid any contagion. So if you do not do it, you take a high risk, and so you probably a kind of quarantine will be necessary in some part of France. I don't say for all France, but we see that what they did in Italy is very important. It's 40% of Italian GDP, and it's very close to France, to south of France. It's very close to Switzerland. It's very close to Germany. So we can imagine that something can be done in these regions.
Yeah, let me ask Stefano Vella. I mean, is the feeling there in Rome? I know you're not in Milan, you're not in the quarantined area, but from what you're hearing, is the quarantine area being, enforced in quite the same way that it would be in China? Obviously, the threat of severe punishment in China is greater than a €200 fine, which is, I think, the fine for leaving the red zone in northern Italy.
Yeah, that's true. Actually, what we feel with our epidemiologists is that actually this is an epidemic for sure. Fortunately, it was started there, or unfortunately, and it's hopeless to think that other parts of Italy will be immune. So we are waiting for the wave to come. And I'm scared that this wave will come all over the world, because that's like influenza. There is no difference. I mean, clinically maybe a little different, but the spread is the same. So we tried to copy, for what we could, what China did, quarantine a part of Italy, which is, I mean, actually very painful. The schools are closed everywhere, all over Italy. We are closing the ski resorts. We are closing. There are no possibilities to do meetings, not more than 1,000 people. Meetings at 2 people are closed. So we are trying to do something which, in a sense, not similar to China, because it would have been impossible, but we think that we can manage to delay the number of new infections, because they will come. We are pretty sure that, unfortunately, this is a pandemic. We think that this is a global pandemic. Now, what is our hope is to, with these measures, to have less new infections every day, because we have like 1,000 every day, at least a test, because we used a lot of tests. And this is true. But actually, because I come from an HIV experience.
Okay, the line seems to be breaking up a little bit there.
And who is not? Mm-hmm. Because that's, someone said before, we need to have the measure of the epidemic, and the only measure is to know how many are infected.
Okay, let me go to Jonathan D. Quick in North Carolina, because I want to ask you, when you were writing your book about the spread of an infectious disease and epidemics, did you take into account, I'm afraid I haven't got the book with me, but did you take into account the idea of governments having to weigh up this dilemma that we've been talking about here, putting the economy before people's lives, and this whole dilemma that our leaders faced? Should they act too early, and could that end up being an expensive, unnecessary mistake, versus at a later stage looking like they didn't nip the problem in the bud?
Well, indeed. I mean, this is the challenge. We've reduced, for example, weather deaths in the last 50 years by 95% because of better warning. But there's always a do we call it or do we don't? We have this in each epidemic. And I would agree with my colleague that says, if you ring the alarm bell too early, too often, people won't respond. And on the other hand, if you wait too long, you'll get slammed. I think that it's that early identification, and then I think the efforts that the World Health Organization has taken, and when they've decided how much of an alarm to ring. But clearly, I would agree with my Italian colleague that it's here. Now the question is how we mobilize the public, the population in different countries to contain it. At this point, there are really about maybe 6 or 8 of those 98 countries which have a real out of control epidemic. And what needs to happen is basically a whole world coordination. So we've got the health people, not just at the local level and the national level, but internationally, the business community, the public health community, really thinking collectively. This is not a time to let the individual squabbles keep going between countries. We need a collective response so that we save lives, livelihoods, and preserve economies. That's the key thing.
And let me just ask you one question, since you're in the United States, which I know is a country that doesn't really go in for paid sick leave in a major way. I mean, here in Europe, at least, if you're sick, you still get paid. So there's no sort of disincentive about taking the day off due to illness. Is that an issue that people are discussing right now? And perhaps how, if there were paid sick leave in the United States, if it was more common, people would stay away from the workplace if in any doubt about their health?
Well, I mean, many companies and organizations, and the best, still do offer sick leave. But yes, I mean, the issue of how employers can best take care of their staff in the context of this outbreak is a conversation that's going on throughout the country now.
Let's move the conversation on to sort of more economic ground. Thank you for sharing that with us. I mean, are we looking? Do you think? And I'm talking to both of you wearing financial hats. Are we looking at the beginning of a period of massive job losses, a period of financial massive downturn? Is this a correction that was long overdue in any case? There are some people who have that argument. What are your thoughts?
My view is that looking at the oil industry, the energy business, etc., my view is that this epidemic will last only, I'm perhaps very optimistic, only a few weeks, a few months. And so you have a decrease in the activity, so that, for instance, there will be not any new project for production, not any new development in the oil and gas industry, for instance, for the next. But it's not a crisis like the crisis we knew. We knew, for instance, in 2015, when we had the fall in the price, where 100,000 of people were laid off, were put out of the companies. So I think that my view is that, of course, we'll have a reduction of activity for a few weeks, a few months. After that, I hope the virus will be sensible to heat. I mean, will be destroyed by heat. I'm not at all a specialist, and that will come back to normal after that. So this is my view. It's a bit different from the previous crisis. Perhaps more difficult to manage for the moment, certainly much more difficult, with probably a lot of losses in terms of deaths. But I think from an economic point of view, it can be relatively limited.
Your thoughts? Who are the big losers at this current moment?
I think that we are ahead of a global recession. Clearly, we've seen a stop in Chinese economy since the beginning of February, and it doesn't recover quickly. We see that in Italy, things are blocked. And what we've seen in surveys is that it's very hard for companies all over the world to have their product coming from China. So their own production will be lower in coming months. You know, in February, they use inventories to produce. But at the moment, you don't have no more inventory. So you have to reduce your production. And in that case, you will have an important impact on activity and on jobs. And the other point is that we have this situation coming from outside, if we are in France or in Europe, and at the same time, government take measures to limit economic activity inside the country. We heard Bruno Le Maire this morning saying that we won't be able to have meetings with more than 1,000 people. He said that restaurant, hotel has down dramatically. And we understand that it's for the best of everyone in terms of health care. but it's a source of break in terms of economic activity. So the question is, we have a persistent shock with strong contagion all over the world, and after that, how many time will it take to recover and to find a new equilibrium? That will be very hard to manage and very long probably. And so 2020 will be a very difficult year for everyone from China to the US or Europe. It will be very complicated because this epidemic leads to a strong disorganization of the world economy. We've seen markets, but it's not only markets. And that's what will be more difficult to manage, how to fix everything. And it's very different from 2008. In 2008, the factories worked well, companies worked well. It was just a problem of liquidity, I would say, and central banks were able to do that. In the current case, companies are not working well because there is no employment in China, there is no employment in Italy. So the situation is different, and interest rates are already so low that central bank cannot be efficient in their monetary policy.
We're almost out of time. Let's go back to Italy and speak to Stefano Vella, because I'd like to ask you, is there any thinking there in Italy as to why has Italy been so badly affected by this? Is it because there's an older population? Are there any thoughts as to how this could have been handled differently? Or do you think this is not unique to Italy and that basically the rest of the world will follow in Italy's footsteps? It's just a matter of time.
Yeah, that's the last thing you said, I think is the right one. We were it first. Of course, we have a very aging population, but that's the same for France and other countries. So the number of the death toll is high. But, this issue is a little kind of chance. It happens that actually we don't know exactly if the first patient came to Germany or to Italy. But actually, at that moment, it doesn't really matter. We don't know. When we have the flu epidemics, we don't have to look at who is the one that brought flu to Florence. This is the moment to keep what I always say to media, etc. Is we need not to panic, but we need to have some fear, because fear is good, because it makes you, what the government decided in Italy changes the lives of a lot of people. They say you cannot stay together, you cannot hug, you close, the bars are closed.
Okay, so some major
universities are closed. So it's
absolutely
some
big measures have been taken there. Okay, we're out of time, actually. We're out of time. Thank you so much. You've had the last word, actually. Stefano Vella, Global Health Professor at the Catholic University of Rome. Thank you so much for speaking to us. We're out of time. Let me also just say a big thank you to Jonathan D. Quick, who joined us from Durham in North Carolina. Thank you so much for speaking to us. And to my right is Philipp Wächter, Chief Economist at Ostrom Asset Management. Thank you very much to you. And last but not least, Jean-Pierre Favenec, Professor at IFP Énergie Nouvelle, and a consultant and a specialist in energy. Thank you very much indeed to you. That was the France 24 debate. It is time now for Media Watch, and I'm joined by James Creedon. Hello, James.
Hi,
let's begin, shall we, with some reaction to what's been happening on the market. It's a dramatic day.
Absolutely. We'll start with this cartoon by Lebanese cartoonist Hassan Bleibel, which I think sort of visually sums up the direction of things right now. Poor old planet Earth caught between the coronavirus and the tumbling barrel there. So that's one way in which it has been summed up. Donald Trump taking to Twitter quite a lot today and minimising, as he has been doing, the coverage of matters, and I suppose indicating that panic over the market is excessive. This was a response to that tweet. basically pointing out the historic nature of what's been happening with the markets, and also saying that Donald Trump, under Donald Trump's watch, the record for the sharpest Dow drop has, well, twice been held by him. Maybe taking credit for continuing Obama economic trends while cutting taxes for the super rich and doubling the deficit wasn't the best approach. So, of course, under the hashtag market crash, there is a lot of criticism of the US, the Trump administration. The last time the market fell this much, George W. Bush was president. I'm going to say this slowly and simply: stop voting Republican. So a lot of partisan comments like that on social media in the US in the aftermath of this. Excuse me, the Trump-Pence administration, at a minimum, is partially responsible for today's market crash. A lot of criticism then for the handling generally of the coronavirus. Meanwhile, criticism as well for the Chinese Communist Party. This after the Deputy Secretary General of the State Council today, or at least in the past 24 hours, said, and it's quoted here, in and before January of this year, there were more than 3,000 medical staff infected by the Wuhan coronavirus. And the conclusion of this, albeit, let it be said, Hong Kong-based Twitter user, is that the CCP were simply lying throughout the month of January when it comes to the figures. Criticism also in the UK for, well, I suppose this is common criticism. Anytime a leader tries to kind of handle the panic factor and calm people's nerves, they're accused of not taking the problem seriously. That's the case here for Boris Johnson, who said that people should take it on the chin and just allow the disease to move through the population. That wasn't to the pleasure of a lot of people. People feeling that he was minimising it, Tom.
Okay, a difficult act for leaders to play, as we've been saying. Do you cause panic or do you downplay it? Damned if you do, damned if you don't. Now, The Guardian has found some reasons to be less pessimistic.
And this I've seen shared a lot in the last 24 hours. I think people really are looking to be reassured. They want to hear why we shouldn't panic so much. So just to go through them very quickly, it is obviously developed further in that article. Why should we not panic so much? We know what it is. We can test for it. We know it can be contained, although at a considerable cost. Catching it is not that easy if one is careful, and it can be killed quite easily if we try. In most cases, symptoms are mild and young people are at a very low risk. People are recovering from it. I think there's a figure of 70% of people in China have recovered, according to the WHO today. Hundreds of scientific articles have been written about it. Vaccine prototypes exist. Dozens of treatments are already being tested. So that's a positive take on it. And I was going to show you all of the reasons why people are not reassured, because people are panicking all over the place still online. But I guess that'll have to be a little bit later this evening.
Indeed, we're out of time. Thank you very much indeed.
Tom.
James Creedon there with today's edition of Media Watch. That's it from me. More news coming up at the top of the hour.